Hello and welcome everyone to our Kyte Perspective, the fifth event in a series of 6 today with our guest speaker, Brendan Cox. Hello, Brendan.
Good morning, good afternoon, everybody. Lovely to see you all.
Thank you for joining us today. So today's topic is all about data, insights and analytics in the home care management and home care service providers. And Brendan, before we dive into that, I actually wanted to hand over the ball very quickly to you to introduce yourself to the audience and let everyone know what your role at Oracle is.
Yeah, fantastic. Thank you, Anita. So yeah, my name is Brendan, as mentioned. I'm a Director of Solution Engineering here at Oracle, but in particular, I focus on healthcare and our healthcare strategy as an organisation when it comes to everything software as a service. So Fusion applications, as we're going to be talking about today. And I'm in a really privileged role where I get to speak with a lot of healthcare providers across Australia and New Zealand on how they're managing all sorts of different aspects of their organisation. But for today's topic, it's around health and, it's around hospital in the home and home-based care and how organisations can get better visibility from their platform and from how they provide the services today.
Yeah, so very interesting topic, and I was really looking forward to that session. But before we dive into the details, Brendan, I wanted to ask you, you're speaking with all these healthcare providers and service providers across Australia and New Zealand. When it comes down to data and analytics, and mostly also predictive analytics, predicting workload and forecasts to enable business owners or business managers with the right insights to make decisions, what do you see as some of the common pain points in the industry?
Yeah, really good question. I think to start with, a lot of organisations are coming from a really low base to work from, very human intensive, very manual. So what this means from a data insights point of view is there's a lot of data kind of everywhere across lots of different systems. And unfortunately today with a lot of healthcare providers, that data is in Excel spreadsheets or on whiteboards when it might be magnets or whiteboard markers, through to even things like photocopy pieces of paper. A lot of organisations have invested a lot in a data warehouse, et cetera, from an IT projects point of view. But unfortunately, that's typically focused on areas such as the EMR, et cetera, where it lacks that complete view of a particular business unit or area that's being that's operating. When we come back to your question, Anita, it really comes down to when you've got all these different disparate data sources. As a leader within these organisations, it's very difficult to make informed decisions unless it's gut feel or what's really coming from your frontline staff. Whereas with modern technologies that are available today, what they can do is help bring everything together and provide you with the ability of seeing the unknown unknowns, so areas where you might not be focusing, but there's actually an issue starting to bubble up. So when it comes to pain points, etc., it really comes down to things like how can we be doing things potentially better, more optimized, providing a better experience for our patients, as well as obviously our employees, which are very, very important.
Excellent. I love it. Well, with that, now I'm really curious to see more. So would you be able to show us a little bit more around what that could look like on Oracle technology? And I believe what we're looking at today is Fusion Data Intelligence, which is one of
Correct.
the modern Fusion Cloud applications, connecting various business units and data streams into one sort of source of data analytics and insights. Over to you, Brendan.
Yeah, spot on. Thank you, Anita. Look, I think, team, for today, what I'm going to do is spend maybe 5 or 10 minutes on a few slides, and really this is just to help give everyone a common foundation to kind of understand where Fusion Data Intelligence kind of fits in and how it supports our healthcare providers into the future. So firstly, what's really important to know is if you don't know much about Oracle, we're heavily invested in health. We have quite a large range of capabilities within our cloud, from electronic medical records through to clinical research, through to the world that I focus on, which is around the business operations side. So when we think about human capital management, enterprise performance management, finance management, supply chain, and today when we're talking about a hospital in the home and home-based care as well. But I think importantly, they're all different, disparate technologies, feature sets built for particular purposes to support an organization. But most importantly, as an organization, we really focus on what is that integrated end-to-end healthcare experience for both your employees that need to, interact and operate with technology to help them do their role, but also your patients and how we can better support them as well as they have their journey through a particular life experience, such as home-based care. So, importantly, while these are certain different areas of focus, they all come together onto, when we talk about Fusion, one common platform. So we're all sharing one set of business processes, one set of data. So this is really important to make sure that everything's kind of in sync and aligned, making sure that everyone has, access to the right information based on their role, but also based on, where they are in terms of what they're doing within their role as an organization, within the business process. I think what's really important to note is, Fusion is well and truly in the Australian market, has been for, actually, I should say Australian New Zealand market, has been for quite a number of years. And that covers, a lot of different capabilities that we can see there across the top. And each one of the logos below are using Fusion for lots of different use cases. So some are using them for the topic for today, but not all. But I think what's really important is it's very easy for them in the future to adopt additional components within here, just through additional licensing and all that work in build up for different areas, such as they might have their inventory as an example, or their employees, rostering and scheduling in the platform already. When you enable another module, you already inherit all that information in that business process. All you're doing is essentially continuing it on. So it allows organizations to not have to do a really big transformation, but keep it to where their project focus is, but tick the boxes off as they go along, moving across to Fusion. The next one is really just to say there's a lot of capability within our application suite. Over on the left, up the top, health is our industry platform, which is the EMR or Millennium, as you know it, as well as our next-gen EMR is also based on the exact same cloud technology. Fusion's in the middle, which is where our focus is today. But I think the key thing is just below Fusion, you can see data intelligence platform and AI and ML. That is where we're going to be really tapping into today. So what's really nice about Fusion Data Intelligence is it knows everything there is to know about Fusion, but it also knows how to talk to health and other health systems to be able to give you that complete view of the world. And it's all natively working with AI as we expect modern applications to today. So that's both predictive, generative, as well as the future of AI agents as they start to roll out within our platform through software updates over, to be honest, we're already 2 releases in of our AI agents, but throughout this calendar year and many more to come. Couple of last slides. Look, I think one of the big things I wanted to do is part of the foundation that I build for everyone here is to focus back onto this slide that I talk a lot about when it comes to home-based care. And it's really to say that you have these amazing nurses that have to manage a lot of different elements or areas across lots of different applications. So things like translation services or broker services through to inventory, rosters, skill sets, appointments, patient locations, staff, disruptions, as well as the patient record themselves. And one thing that our hospital in the home solution does incredibly well is bring this all together, put AI over the top, to help you execute this in a much more optimized way, taking a lot of that burden off our individuals, our employees, but also better equipping individuals out in the field with more visibility, offline capabilities, tracking for occupational health and safety, but also brings the patient into the ecosystem as well. And what we're going to be focusing on today around Fusion Data Intelligence is really how do we now bring AI to the analytics that sit over the top of this? So when we're moving out of the patient view, we're moving out of the running of the day view and starting to look at how are we operating at a weekly, fortnightly, monthly, yearly view, and what is the impact on our staff, what is the impact from a financial point of view, but also what's the impact from a patient outcomes point of view as well. So we'll jump into the tool and start to have a look at that further on. All right. So Oracle Data Intelligence, Fusion Data Intelligence is what I'm going to be spending some time on today, but it's worth knowing that some of you may have heard health data intelligence, especially our customers that are currently running Millennium from our Oracle Health team. And the one thing I want to highlight is the fact that our Fusion Data Intelligence and Health Data Intelligence share the same common platform, but offer two very distinct roles. So Fusion's very much focused on the running and maintaining of that front office, back office side that we're going to focus on today, whereas Health Data Intelligence is very focused on Oracle Health and Millennium. But importantly, these do talk to each other. They do share information. So if you are investing in one or the other, you're starting to build towards that foundation from an organizational change management point of view or a data sharing point of view, so you can reap the benefits of the full suite in the future. And yeah, so today I'm not going to be focusing on this, but as you can see here, there's a lot of capability around clinical intelligence, care coordination intelligence, and healthcare analytics, looking at things like population health, etc. over the top. All right, so for today, Fusion Data Intelligence. Fusion Data Intelligence is a platform that gives you the ability to tap into all those key areas within Fusion, based on what subscriptions you have available to you, but also importantly, also tap into other third-party cloud applications as well. So if you have applications from a third party, such as Salesforce, ServiceNow, Microsoft, it might be some on-prem tool, it might be your data lake that you want to tap into as well and augment and create really nice visualizations about how your organization runs. This solution allows you to do that in a really seamless and easy way, which we'll show in a moment. As a fun fact, I even have a lot of organizations on the higher education side that will bring in volunteering services, broker partners, etc., and bring in their data sources as well to then enrich Fusion Data Intelligence. So as an organization, they get a complete view. Within Fusion Data Intelligence, it's designed to be, a lot of our competitors when it comes to data intelligence really look at providing a platform that you need to then go and build your metrics, build your reports, build everything else, where our focus is really that Fusion Data Intelligence should be software as a service. So in that regard, it should be 80% out of the box, 20% just tweaking for, what makes your organization unique. What are some of the additional metrics or fields that you capture or utilize as an organization that would have been built into Fusion, that we need to, absorb and bring into particular different data models that are available. But out of the box, we offer data models across, suppliers, your people. So people are both employees, but also, partners, patients, contractors. A person is an in-person that might have multiple roles within the data model, and it's something to be aware of. Because if you think about it from a health point of view, you will have employees that might also be patients as well. So it needs to be mindful of those kinds of relationships. Inventory is obviously another really important one as well. And then I think if we build this out, it's not just about having those data models, it's also about having the KPIs, or the metrics that sit below that. So there's over 3,000 metrics now available out of the default data model for you, because we know Fusion. So building an intelligence platform over the top is very easy for us to do. And what's also really nice about this is as the product evolves, it will give you additional metrics, because what we do is we've got a center of excellence team that work with a lot of our customers. They provide Fusion Data Intelligence sprints. And it's a free service that we offer to get you to have a look at the tool, understand the tool based on your Fusion data. And what's really nice about that is as you use that tool, build particular reports out, if they're common or things that might be of benefit to the wider ecosystem, we push that to the common object and everyone gets that in the next release. So they're not getting your data, what they're getting is that metric or KPI based on what's been built into the system, because we're all sharing that same common framework. Very importantly, obviously, it needs to have AI and ML models, and we have predefined ones, but also you have access to a a suite of intelligent applications that allow you to build your own models, but also start to leverage some really unique experiences, such as generative AI conversations with your data, which we'll talk about today. And I think finally, the last piece of the puzzle is not just about having metrics, it's about having dashboards. So we have pre-built dashboards for particular personas based on particular roles that are available to you out of the box as well. So it's not just about having a metric, it's about having, the actual representation of it correctly based on, particular persona within the organization. All right. So that is the last slide. I promised I'd only keep it to 10 minutes, and I have. So for the next 10, 15 minutes, what I'm going to do is now jump into the product and show you what it looks like. So with that, share my browser, and we should be starting here. Awesome. All right. So this is Oracle Analytics. This is Fusion Data Intelligence, well, a component of it. If Fusion Data Intelligence includes a lot of different capabilities sit below this to make sure that you've got really good data. So there's a lot of data hygiene capabilities, connective capabilities to connect into your different services. But what we're seeing here is what a business user would see. So within Oracle Analytics, you have predefined dashboards, but also the ability to create your own, which you can see up there in the top right-hand corner. For today, what I've done is jumped into a couple of Fusion Data Intelligence dashboards that I've defined, where we can start to get a view operationally of how our hospital in the home services are currently going. Now, all the data in here, I will preface, is dummy data that is in my demo system. So please don't hold me to any of the metrics, but hopefully it gives you a really good idea of the types of metrics that we can display, but also the types of ways that we can actually display data. So we've got some really nice metric tiles across the top. We've got, line graphs based on patient volumes over the last 30 days or so. Also things like map views where we can start to see patient distribution. And because I do presentations across Australia, I keep it to Australia, but it might just be your geographical area or particular metro area that you're focusing on. So it could be based on postcode, lat long, those kinds of things as well. We can also start to see a bit of a tile graph here around the different types of conditions that we're managing within the hospital and the home service. And really, I can put whatever I like in here to get that overarching view on how the service is being provided. And if we have a look down the bottom, we've also got tabs as well. So if I click on each one of these tabs, we start to drill into different areas of the data. So as this screen loads, we can start to see things like our on-time visit efficiency. What's the average kilometers that our clinicians are traveling? What's the average travel cost per week? So what's the fuel costs, the vehicle costs that costs each week to actually provide this service? It might be forecasting around, if you think back to previous presentations around hospital in the home and the digital whiteboard and having that Gantt view of the day or the week of where everyone's going and what they're doing, giving you that high level view of, okay, this is the available staff I have versus our forecasted workload versus what's currently booked. So you can see we've got too many staff at the moment next week within the system. So giving you that forecasting capability quite easily within the system. But if we scroll down, we can also start to see things like a heat map. So the time of day, the day of the week, when are we most busy? So we can see over here that we're really busy on a Thursday at 12 p.m., but also a Thursday at 8 a.m., but very quiet on a Wednesday at 12 p.m. So we can look at ways that we might distribute work, or we might change or distribute less important appointments, such as what we call non-scheduled work. So it might be a checkup that needs to happen within 3 days rather than a particular drug that needs to be administered, at a particular time of a particular day. If we go through, we can start to pull information out of other systems as well. So it could be, within our tool, so your prems and proms, and looking at things like, improvement over time. But it might also be things like, pulling data out of the EMR or out of your data lake to actually cross-match with data in Fusion to look at things like, okay, with our patients, how many are actually, escalating back to the hospital, right? And if we come down, again, this is really just displaying different types of data that you might want to present, or understand as a manager within the organization. Also, importantly, the financial impact as well. So if we have a look here, we can see things like, do we have an ROI as part of our project that we need to manage it towards? How are we going towards that target? We might be wanting to report back to our senior management around, how things are going from an ROI point of view, which you could do, but even breaking it down on services as well. So you can see this isn't just, the workforce scheduling, but also clinical outcomes, finance, as well as we might be doing other patient-based engagement as well, such as surveys for NPS, or it might be, how are our patients choosing to interact with us across different channels, whether it's telehealth, SMS, email. It allows us to track it across the whole lot, even where there's some form of voice to text or email, where we've got some form of written explanation, or again, in the surveys, start to build out things like, what are we doing poorly, what's neutral, or what's positive in some form of word cloud. So there's lots of different ways to actually visualize a lot of the information that's available to you, or might be disparate today. Now, this is just a quick show of our different dashboards and some of the different ways we can show the metrics. But I think the real power of Fusion Data Intelligence is giving you the ability to actually create and manage and change these dashboards. So you might have a theory that you want to then go and prove out. So as an example, my little demo today is we want to do a bit of an investigation based on diabetes management. So if we click on diabetes as an example and go click selected, keep selected, what we can start to do is drill down and go, okay, for diabetes, how many active patients do we actually have in the current service? So very quickly, within a couple of clicks, keep selected, I've created a filter, which is brilliant, nice and easy. But one thing that I noticed when I was preparing for this demo is if I go to our clinical outcomes, I don't know whether you remember, this was 4%, and all of a sudden it's jumped to 6%. So, okay, well, what does that mean for the other types of conditions that we're currently managing? So you can see there's lots of different conditions here that we're managing. So let's dive into a little bit more detail there. So what we can do is we can come across here and we might go, let's duplicate this visualization. We will drag and drop it down a little bit. You know what? We might choose to change this to a bar graph. So now we've got it as a bar, so we can say exact same information, 0.4% or 4%, 0.4 of 100 or 1. And now we want to do where we want to look at all the different services, not just this one particular one. So what we can do here is come across to our data set that we're getting out of Fusion, come down to our patient episodes where we're capturing the condition, drag and drop that in as a category. Brilliant, cool. So we can start to see what this actually means. Oops, I want to do escalation to hospital, high to low. You can start to see that, okay, UTI, we actually have the highest rate of escalation, and then we work our way down. So we've just proved our hypothesis and been able to very quickly interact with our data to be able to see something new that we weren't aware of previously. But I mentioned AI, and I think this is where the world is going. And I know I've got 6 minutes left, Anita. So what's really cool about Fusion Data Intelligence is everything I just did, it's already done for me, plus some. So let me talk about what I mean. So let me just undo all those changes I made and click on the little light bulb moment that I'm going to have over here. So if I click on Insights, click on the light bulb moment, you'll notice that the system has just gone and queried the whole platform, and it's actually suggesting analytics for me based on what it knows within my data. And it's also giving me an explanation of what it found, right? So it's giving me insights. But, we talked about proving a hypothesis. So what we can also do is we can have a generative conversation with our data. So if you think about the question that we just asked then around escalation rate to hospital, let's go with if we look at escalation, if I can spell right, rate to hospital, because that's what we're having a look at, escalation rate to hospital. Can you create a chart of each condition, each condition's impact if I can spell on that. So let's ask it a question where I've misspelt it. So we'll see how we go. Is generative, so it should just pick up and just work. Essentially, yep, perfect, it's done it. So if you remember, I spent 30 seconds, 40 seconds clicking around, doing filters, building out that report. But at the exact same time, I've done the exact same thing in a matter of seconds by asking Fusion Data Intelligence a question to go and prove that exact same hypothesis. So that exact same data, and now I click add, and I can add different fields, or I can just click add here and add it directly to the canvas. So very quickly, very easily, I can actually go and create whole new reports or graphs available to me to then be able to, add to my view of the world. So while there's a lot that we offer out of the box, it's very easy for you using AI, generative AI, to essentially create your own, graphs and visualizations of the data. The final piece that I want to mention is, this is really good having all this data available to us, but how do I show others? So the final point is what you can do is I can play and go back to that exact same view where I was, but now my new report's in there. But also I can share this. So I can actually export this to, say, a PowerPoint and be able to share that with my senior leadership team on how our organization's going. So not only do I have, real-time visibility and visualization of my data, it allows me to create new visualizations of, different areas of focus that I have. It even through that insights area allows you to be suggested on things you might want to look at. So looking at those unknown unknowns, areas or issues within the business you may not be focusing on, but this can bring that up to the surface before it becomes a real problem. And then very easily, I can share this, create a PowerPoint presentation, and then present that to my senior leadership if I'd like to as well. So for the time that you've given me, Anita, I'm going to hand back to you, but that was my demo in a really short time that we had today.
See, I love it. You're a fast speaker and pack all relevant information in within the short period. So there we go. Absolutely amazing. One question I have, Brandon, so all of this functionality is all out of the box functionality and just configuration?
Correct. That's exactly right. So it's all configuration. So again, I ran out of time, but on the left-hand side, you've got all your data out of Fusion or your different data sources. You drag and drop it onto the canvas and build what you like. We use AI to help you build those dashboards and analytics that you want, but we also offer quite a lot out of the box.
And specifically for home service providers, we know a lot of organizations don't only use Oracle, so they have a whole bunch of legacy systems and other things. So you also said we can easily connect those other systems with FDI as well, with that analytics platform, and bring the data in.
Yeah, spot on. Even other data platforms as well. So if there's an investment in Amazon or something else that IT are really keen on, that's completely fine. We're designed to work in harmony. I think that's a big thing about Oracle. We're always about working within your existing ecosystem, not trying to push others out or choosing not to integrate.
Yeah, awesome. And those AI agents, I'm also understanding each quarter Oracle will just add to them and their capability. Am I correct? So what I'm seeing here,
right.
I love it. I'm a data girl. I love looking at data to analyze, where we need to tweak things. But having AI look at the data and prompting me the insights is a game changer. So super fascinating.
Yeah, for Oracle, AI is just a part of the subscription. So we don't charge extra like a lot of our competitors do. It's just part of the platform.
Absolutely amazing. Well, I have no further questions. At that point, I want to say thank you so much, Brandon, for showcasing us the power of FDI. For anyone who has been watching this video, or even if after the fact, you look at this later tonight or tomorrow or the next days, any questions, please get in touch with myself or with Brandon. Leave a comment, and I'm sure we'll speak soon. Thank you so much, Brandon. You have a good day.
Cheers. Thank you so much.
Thank you. Bye.